Good afternoon. Welcome. My name is Kirsten Sickley, and I serve as the Chief Executive Officer of YWCA Central Carolinas. Our team at YWCA is delighted to continue this partnership with CapTech Consulting on our three-part series called Why Women Vote 2020. Today's third and final panel focuses on the health of women and girls. Why Women Vote 2020 is YWCA USA's third national survey administered by bipartisan researchers. Despite the national narrative of divisiveness and polarization, women actually share strong alignment on priorities across race, ethnicity, age, education, and political affiliation. After today's robust discussion, you will receive a survey. Please do take a moment to share your feedback with us. I'd like to thank our friends also at Corning, who are sponsoring today's panel. Corning is a leading innovator in materials science that shares YWCA's commitment to eliminating racism and empowering women. We are so grateful for Corning's support. And now it is also my pleasure to introduce our wonderful moderator, Elena Brocious. Elena is a principal at CapTech Consulting, having previously led teams at both Amazon.com and Capital One. With 3 daughters of her own, Elena is a passionate advocate for children and their families, especially those that are facing challenging circumstances. She enjoys spending time with her own family in the Blue Ridge Mountains. Elena?
Thank you, Kirsten, and thank you again to the YWCA and to Corning for sponsoring and for inviting me back to facilitate this third discussion in the series. For those of you that joined us for our first two discussions, you know that we bring experts that can speak to the issues that are facing women and girls. And today we'll dig into the complex topics of women's health and wellness. And more importantly, we'll talk about what all of us can personally do to take action through advocacy. And I'm so excited to introduce you to today's 2 panelists. They are experts in addressing health concerns for women and girls today, including things like comprehensive, affordable health care, especially for those with pre-existing conditions, birth control and preventative health screenings, such as mammograms and annual checkups, increased mental health services for those who have faced trauma in their life, and access to a full range of reproductive health care, and also passing legislation. You guys know, if you've joined us for our first two conversations in the series, we talk a lot also about policy and what we can do to support policy changes and make choices in the voting booth that will help women and girls. So let me introduce our panelists. Dr. Kim Barbell Johnson is a family physician and a physician's scientist who joins us from Jacksonville, Florida. With 2 decades of patient care experience and with leadership of several clinical trials to her credit, she brings a wealth of knowledge to today's discussion. She grew up in the U.S. Virgin Islands, and she earned her undergraduate degree from Hampton University, which is an HBCU, as many of us know. And she also has long-standing active participation with similarly passionate servant leaders and sisters in the Alpha Kappa Alpha sorority. And so she has a natural passion for advocacy for women and minorities. So thank you so much, Dr. Kim, for joining us. Caitlin Lowry is also joining us today. She is a public policy and advocacy manager at the YWCA USA, and she joins us from Washington, D.C. today. She brings almost 2 decades of experience in women's human rights work, and she has worked in governmental and nonprofit spaces to eliminate gender-based violence and improve and protect women's access to health care. She earned her undergraduate degree from Wilmington College and her graduate degrees in women's studies and law from the University of Cincinnati, where she was a human rights fellow, actually. So Caitlin, we're super excited to have you and Dr. Kim join us. Thank you guys for coming today. And I think you're both still muted, so make sure you're unmuting. As we get into questions, we'll dive in. So Caitlin, I want to start with you. Can you give our audience a bit of context? We like to start these conversations with a bit of context setting on the YWCA, their survey, this third national survey of Why Women Vote 2020. Without getting into a ton of detail, talk to us about what that survey informed us about as it relates to women's health.
Thanks so much, Elena. And thank you, Kirsten, for having me here today. Kirsten, as Kirsten said, Why Women Vote is our third national survey. We conducted it at the very end of 2019, which is when the report was released. And we surveyed women across the United States to find out what their concerns were, what their worries were, and what their legislative priorities were. We learned that 79% of women were very concerned about the election because they believed it was going to have a very large impact on their lives. They shared some key priorities, and of those key priorities, healthcare was at the very top of the list. In fact, their two top priorities were around healthcare. The first was around safeguarding healthcare coverage for pre-existing conditions, birth control, and preventative healthcare services, things like mammograms, annual checkups. In fact, 77% of women said that should be a top priority for the next Congress and next administration. Should be a very, very strongly felt that way. A total 92% felt that way. And then the other top priority was around expanding the availability of mental health services in schools and communities for women and girls who had experienced violence, abuse, and neglect. So in terms of top priorities for the next administration and Congress, those were far and beyond the very most important things. And then women also shared some key worries and concerns around healthcare. In fact, two of the top three concerns for women overall were around healthcare. So those were around having affordable and secure health insurance for you or your family. In fact, 69% of women felt that was a concern. 47% of them were very worried about this issue. And also having a medical expense for you or your family that they could not afford. 68% of women were concerned about this issue. 45% of them were very concerned about this issue. I also wanted to share that we are still conducting this survey only at a state level. We actually just finished conducting this survey on the state level in about 5 states or so. So we'll be releasing some additional state level data with those same questions shortly. And you can find more information about the original survey and soon the state level data at YWomenVote.org. So I encourage everyone who's listening to this to go to that website to learn more about that survey and definitely to register if you haven't already registered to vote. So, yeah.
That's a great overview. Thank you, Caitlin, for providing us with that little bit of detail. It's interesting for those of us who've joined the first 2 conversations. It's crazy how divided so much of our country is right now on a host of topics. And at the same time, we're finding out through this information that women are so united in so many of our perspectives on a range of topics. Dr. Kim, in your career as a family physician and now as a medical director for clinical trials, does it surprise you at all that women are this aligned as it relates to healthcare priorities?
Short answer is no. Let me thank you for inviting me, YMCA, and those who are gathered here today to share in this very important conversation. As a mom, it doesn't surprise me when I hear of the concerns of other moms. As a boomer physician of mixed Caribbean heritage, as I read the report, I saw things that are familiar to me and familiar to those who are like me. As a mom of a Gen Z high school senior and a Gen Z college senior, I get the concerns that are represented in that survey. And as the daughter of memory challenged octogenarians, I totally get the concerns that the YWCA was extremely efficient in eliciting through the work that went into administering this survey. So no, the short answer is no. I think it's important, one, to say, though, as we're talking about a survey, and it's a space in which I live, that this is a well-done survey. The information was put together in a way that was culturally competent and was the data should be trusted in that it really does reflect our community, and it helps to raise the voice of many of the voiceless in our community. So I wanted to actually just commend the Y on the 3rd year of doing this in such an excellent way, a document that can serve many of us in the medical community and others to help to better understand those whom we serve. Next, I'd like to just say that it really does reveal those factors that contribute to what I call toxic stress. And while we often as clinicians talk about heart disease and cancer and other things, these are the stressors that often contribute to worsening health in women and in patients in general across the board. So So the survey, as I read it, really did a wonderful job in unveiling what I and other clinicians understand to be those damaging effects that impact learning and behavior and health and lifespan. And I just encourage those who are yet to take it to consider taking it, and encourage the YWCA and those your sponsors to continue to do such great work in this area.
So that's fantastic information. Thank you for the continued support and making sure that we get the data that we need. I think it's a great reminder for us. Caitlin, you talked earlier, we found out that you are advocate and an activist on Capitol Hill. Thank you for all that work. Talk to us a little bit about the legislative efforts that are going on. I imagine that having so many aligned voices from women across the country on all these topics, that you guys probably hear that echoing on Capitol Hill. Tell us what's going on there, especially around protecting and advancing comprehensive, affordable health coverage for women.
Yes, we definitely hear this coming from Capitol Hill. We've been hearing it for years now. So of course, the YWCA is always trying to protect what we have in terms of healthcare. So we're always trying to protect the ACA as it stands. But we're also looking to improve access to affordable, culturally competent, quality healthcare. We fight against any efforts to remove the ACA without an adequate or even better healthcare system, and that better healthcare system needs to have coverage for the full array of essential health benefits. It needs to have protections for survivors of domestic and sexual violence. It needs to have a structurally sound, well-funded Medicaid program. Needs to have protections and access to the full range of reproductive health services for women and girls. And it needs to have full and affordable coverage for people with pre-existing conditions. One of those bills is currently Medicare for All. That isn't the only bill that YWCA would support, but we do support Medicare for All. So any bill that would come forward that would cover all of those things is something that we would support. But we need any bill that comes forward to cover everything because we know how important healthcare coverage is for women and girls.
So that's such a great point, that it is so important for all women and girls. And I know that there is a ton of research that documents the fact that, especially for women and girls, minority women and girls, or socioeconomically disadvantaged women and girls, that there's a huge disparity in healthcare and health outcomes for those populations. So let's talk more specifically about efforts to eliminate specifically the maternal health disparities. That's one means to advance health for women and girls. Dr. Kim, can you maybe share from a provider perspective what disparities you see in that space, if any?
Like you said, there are many health disparities that even in 2020 we continue to deal with. In this space of maternal health disparities, I think it's important for us to realize and just revisit the fact that American women, despite all of our benefits in this country, we still die in childbirth at a higher rate than any other developed country. It's an unfortunate fact, but it is a fact. And non-Hispanic Blacks are 3 times more likely to die having a child, to have a maternal death outcome. And so first of all, how do we define this number and this data that we're looking at? It's not just dying having a child. We're looking at data that represents women who are dying across these ethnic minorities in particular, either right before death, right before delivery, during delivery, or up to 1 year after delivery. So I think that's important to understand when you think about needing care, not just to deliver that child or your children, but to have care beyond that, because that statistic is quite alarming when we look at the maternal health disparities. So a death of a mother during pregnancy or within 1 year postpartum are reasons, like Caitlin said, that we need to have access to care. There are about 700 pregnancy-related deaths in this country each year. And the most unfortunate part, I think, is that 3/4 of those deaths we feel as clinicians and as a medical community are preventable. Why do I say that? Well, the causes that you will see on reports such as death certificates are things like cardiovascular disease, or which are heart disease, or hematological diseases, blood-related diseases, clot-related diseases, or infection. Those are things that we can treat in this country. But when we look at the data and we really look at the data that we have in this space, we see that Black women in particular have a worse outcome from cardiovascular conditions in pregnancy. And a number of the deaths due, the maternal death in Black women is actually due to blood pressure related issues, things that we call preeclampsia and eclampsia. Again, conditions that you can identify early, treat and intervene, and can prevent maternal death and outcomes. And so it's important that we kind of look at the global data, but that we drill down these numbers so that we can respect and understand exactly what we're dealing, because the disparities are many. And that's just a few of them. In Asian American and Pacific Island women, we see the same thing when it comes to gestational diabetes. And, you know, as many of you know, women with gestational diabetes are more likely to have diabetes after pregnancy. And so what happens when their care is cut off after the delivery? So it's important that we both recognize the horrid nature of this data when it comes to maternal death and maternal death outcomes, but to understand the overarching need for care along the continuum of life.
Caitlin, do you see an appreciation and understanding from those on Capitol Hill about not only the need, but the disparity in this data, and what legislative efforts are going on, if any, to specifically address the disparity and the urgent need in this space?
Oh, we definitely do. And just to piggyback on your comments, Dr. Kim, it's not just maternal mortality. So it's not just death, but things like severe maternal morbidity. So when you have a completely life-changing or life-altering disability that occurs because of pregnancy or childbirth, there are a lot of disparities that happen there as well. And it's something that YWCA USA has been focusing on pretty heavily in the last few years. On Capitol Hill, there's actually a lot happening on Capitol Hill right now, specifically in terms of disparity and maternal health. In fact, in both the House and the Senate right now, there is an omnibus bill that's called the Momnibus, specifically the Black Maternal Health Momnibus. It's Senate Bill 3424, if anyone is writing this information down, and House Bill 6124. And it covers, I'll just read these out quickly in case anyone's interested. It covers the Social Determinants for Moms Act, the Kira Johnson Act, Protecting Moms Who Served Act, the Perinatal Workforce Act, Data to Save Moms Act, Moms Matter Act, the Justice for Incarcerated Moms Act, Tech to Save Moms Act, and the Impact to Save Moms Act. And all of these things are focused on all of the different ways and all of the different parts of pregnancy, childbirth, and postpartum care where things go wrong that lead to maternal mortality, maternal morbidity, and the disparities that are happening there. So that one Momnibus bill is getting a lot more co-sponsors, but we need more. So please contact your members of Congress. But would take care of a lot of those. It includes funding to get some maternal mortality review boards up and going in states, because a lot of the problem is we don't have accurate data coming in from states to actually know what's going on. Maternal mortality review boards are in some states, but the data is not in all states. It's not always being reported accurately. So we don't know what we don't know sometimes, so we don't know how to fix when we don't have accurate information. And there's still things like shackling going on in states. It's been banned at the federal level, but shackling of pregnant women is still happening at the state level in state prisons and in local jails. So there's legislation to correct that as well. There's a bill called the Stop Shackling and Detaining Pregnant Women Act that also focuses on immigration. So when you're detained in immigration. So there's a lot happening on Capitol Hill. And again, we can talk later about how to talk to your members about this, but definitely Capitol Hill is very interested in this issue right now.
So we talked a ton at the beginning about, or really at least hit on, the idea that we would give folks who are listening to us today some ideas on how they can locally advocate and personally advocate. Caitlin, you just made a great point that we should reach out to our members of Congress to advocate for these bills. That's one very tangible way to get involved and to be an advocate and a support to women who need this support. Dr. Kim, I wonder if you could tell us if you have other ideas on ways that we can become advocates and allies more locally in our day-to-day. What can we do?
I do. I'd like to just say that in parallel to what's going on Capitol Hill, in organized medicine, something that we don't normally see our partners together. Just recently in August, there was a joint statement put together by societies of reproductive and endocrine fertility, College of Obstetrics and Gynecology, the American College of Osteopathic Obstetrics and Gynecologists, which is led by a friend, African American physician, Octavia Cannon, a friend of mine, the National Medical Association, and others that actually created a joint statement because of these very same issues that will actually be supportive of any actions that we can do to support the mom with a spill. And in their statement, I'd just like, if you will, Alana, just to kind of share their position. And they say that as our nation confronts systemic racism and consequences of persistent inequities and disparate outcomes in healthcare in our organizations, that we must be committed to a better future. And that requires honest examination of the past and the present. And I think what's interesting about this is that these organizations recognize that this is not something that just happened, that we have a history in our country of ignoring issues. We have a history where we've experimented on enslaved women in the interest of science, in the interest of other women, that got us to the place that we are, that creates these unfortunate statistics. These organizations have come together in this joint position statement to talk that beyond the scope of this document, that they are committed to doing things like collaborating for transformative work, to do the real work in this space for better health outcome, to educate, to recognize, to provide scholarships and research and publication and guidance to organizations and partners like yours and clinicians like mine to be more inclusive, and we're going to hold them accountable. We're going to hold them accountable as a community of women. We're going to hold them accountable that they have the diversity and those at the leadership table to make sure that this joint statement is more than words written on paper, because it is important that we continue to push for advocacy and for policy, but it needs to translate in the halls of medicine, and we're going to make sure that our clinicians are become more aware. But in general, the question about advocacy in general, what can we do? And I'm assuming those in the audience are as multifactorial and diverse as those who are gathered on our video. But I think that we need to just continue, like I said earlier, to talk about those, continue to talk about the impact of social determinants of health. Just recognize that health is not just a disease with a title or a billing code, that stress, trauma, food insecurities, neighborhood violence, access to prenatal care, the continuum of health, that those are very important issues, and that we need to recognize, even though we might be myopic on our issues in which we're advocating for, that we recognize that it really is on a greater foundation, and we must also recognize that there's implicit bias that we have as individuals and that our organizations and our employers have, and we must be honest with ourselves to really push past our own implicit bias in order to get rid of racism and the bias that may exist in policies and procedures in the halls of medicine or in policy. And then maybe lastly, I'd just like to say that what we can do as just general citizens who may be on this call, who just have a passion for helping and for services, is to know the issues and know the facts. We're in this age, I'm raising 2 young kids, where information comes as quickly as it can in and off of the screen, but really know the issues and know the facts. Spin is in, and unfortunately spin is in. So we need to really kind of push past that so that we can know really those for whom we're advocating, know those for whom we're advocating. In this space, it doesn't take you long on the television to see what performative activism and allyship looks like. We need to push past and see through this performative activism that's now in, so that we can really get to the real issues and stay so that we can have sustainable change as we advocate for those who we really are advocating on, who are in need of our advocacy. So with that, I'll just end there, because obviously I can run a laundry list of ways that I would suggest and have had experience in advocating for those who I think are deserving of our voices.
Kim, it looks like you want to add something. Go ahead.
That was
Caitlin.
that was wonderful, Dr. Kim. I think just to piggyback on that, when you were sharing your statement, the thing that popped into my head was something that we used to say a lot. I spent a year of my life campaigning on maternal health issues. And one of the things we used to say frequently was that women are dying not because we don't know how to save them. We know exactly how to save these women. Women are dying because we lack the political will to save them.
Exactly.
Yeah, I love one of the things you said, Dr. Kim, about getting to know, just get to know people who don't look like us, right? Like who, for any of us as individuals, get to know people and invite them in your circle and then build an understand the situations that these women face. When we build those relationships, I think some of those unconscious biases and the history that you talked about, which I so appreciate that you brought up, this long history that's gotten us where we are today, we just become so much more aware of it. It's one thing to read something in the newspaper or to see it on the news, but when you're living it through a relationship that you've built, it becomes very real. And I think our action becomes much more meaningful, and it can be more local too, right? We actually had a question come in, speaking of sort of the history of the United States and what's gotten us where we are today. There was a question that came in specifically about Native American women and how they uniquely face a much higher degree of domestic violence than most other groups. And there was a question about how this specifically might impact the way that that healthcare metrics for Native American women might show up. But I wonder if you guys had any specific insights in the space of Native American women and what the data might show us, or how we can particularly advocate and support that group.
Caitlin, do you want to go first?
I'll let you go first on this one.
Whether it's Native American women or, like I said, I'm from a mixed ethnic Caribbean heritage, very sensitive. But I think it's important, even things like the census, it's important that we understand that Native American women exist and who they are in our charts, in our advocacy files, in our databases. We need to understand who they are. I spoke yesterday to one of our insurance partners and a friend who works in that space for diversity. And we actually talked about how often we don't have the information that we need to identify subgroups as we make these blanket policies to care for people. And so while we are tracking what we're doing, we're not always tracking the specifics, the subgroups among those that may need things a little differently, may respond to things a little differently. And so it's important for us to call things as they are and to call people as they want to be recognized, and then to track that. Data is important, particularly in this space. And I think once we see that, we can study that and we can talk to that group to better understand the etiology of what's going on and then respond appropriately to what may be causing these alarming statistics. And
it's a great call. That's a great call out. So I want to go ahead, Caitlin. Do you have something to add?
Oh, no, I was just going to put in the chat box a link to the data we got from YWomenVote on Native women, because we did make a specific effort to reach out to that community to see what their concerns, their worries, what they wanted to see from our congressional leaders. Ashley, you're right. Domestic violence was a huge concern for Native women. But healthcare was as well. You'll see when I put this in the chat box. Let me actually go ahead and do that. Their concerns, well, let me send it, I'm not sure if it will, that their concerns were much higher than women overall around healthcare and the need to access healthcare, and especially the need to access healthcare after experiencing an episode of domestic or sexual violence. So these concerns are important, and they're things that we only learn when we listen to Native women. So it's something that we need to get better at doing.
Mm-hmm. It's a really great point, and thank you for sharing that. We'll make sure if it doesn't come up in the chat, we'll make sure that we send it out so that everyone can see that. We'll get that figured out as well. Caitlin, I wonder if you can't share with us a little bit more about what we found out in the 2020 survey and how that relates to top priorities around advocacy, specifically in the space of family planning and reproductive rights. So we know that from that survey that women, again, were super strongly aligned on that being a top issue that they care about, and that they support a full range of family planning and reproductive health care advances for women. So in this election year, Caitlin, what are the YWCA's top priorities for advocacy in this space? And what are some of the challenges that you're seeing?
Whew. That's a big question.
It's a big question.
It is a big question. YWCA USA has a big slate of priorities for the 116th Congress, which included 2019 and 2020. So our overarching priority in the healthcare space was to ensure the availability and accessibility, actually, of quality, affordable, and culturally competent healthcare for women, girls, and marginalized people. So within that broad arena, we specifically supported the Affordable Care Act and opposed any efforts to dismantle it without that that plan that I discussed, that provided all of the things that we needed a replacement plan to cover. We needed trauma-informed care. We supported comprehensive reproductive health services, including abortion care. We supported improved maternal health outcomes for women of color and the elimination of health disparities. In that vein, we supported multiple pieces of legislation, the entirety of the Momnibus, plus a lot of other pieces of maternal health legislation. We've supported the Health Equity and Accountability Act, which specifically speaks to health disparities, the Medicare for All Act, a lot of mental health bills we've also been supporting. In terms of what we're facing in 2020, we can look around us and see that COVID-19 has caused a lot of health issues and a lot of problems. The COVID-19 relief packages have included some health provisions to help people because COVID-19 has been causing problems with health and with reproductive health. And so some health provisions have been put into relief packages, and we've supported those provisions. But there are also other threats to healthcare that are showing up in 2020, specifically threats to the ACA. There are efforts to dismantle the ACA that are currently working their way through the court system. There's a case actually that was brought by state attorneys general that is due to be heard by the Supreme Court right after the election, which is why this SCOTUS vacancy that was left after the death of Justice Ginsburg is really important. Whoever fills that seat is going to have a say into whether or not the Affordable Care Act stays or goes. So that's a really important seat to be filled. They're also going to have a say into whether or not Roe versus Wade continues to be the law of the land. So the Supreme Court right now is having an empty seat on the Supreme Court this close to an election, and with so many important cases coming up to the Supreme Court, makes this a really vital issue. And YWCA USA's stance is that we're far too close to an election, and that the American people need to have a say into who is going to be the next president, and the next president, whoever that is, should be the person to pick the next Supreme Court justice. And I will agree with you about our survey in that women around the country are very supportive of reproductive health issues. They're very supportive of Roe versus Wade, and they're very, very supportive of the Affordable Care Act and all programs that maintain coverage for pre-existing conditions and reproductive health services. So there are a lot of threats to those things in 2020, but women, no matter their race, their ethnicity, their income levels, or their political affiliation, are supportive of those things. So that's just something to keep in mind, that our news cycles may tell us one thing, but women themselves believe something different oftentimes than what our news cycles will tell us.
We've talked a lot about the Affordable Care Act, right? You just mentioned it several times, and we know that provision has safeguarded healthcare coverage for pre-existing conditions. Can you guys both speak to what that provision actually means and how it might play out, both on the personal side? Dr. Kim, maybe you could speak to us about how that shows up for families that you are familiar with, and then also on the policy level, how what it means and how it plays out and what we're seeing on Capitol Hill in terms of protecting that, Caitlin. So Dr. Kim, I'll let you go first.
I just want to actually just say, first of all, that regarding the ACA, health insurance coverage is critical. It's not optional, it's critical. It's a critical factor in making healthcare affordable and accessible. And those may not always be the same thing. The ACA expands access to affordable coverage through a combination of things, whether it's tax credits or expansion of Medicaid. And it's exactly what we have needed in the past decade and what we continue to need. It's the last thing that we don't need at this point as we make these minor but progressive gains in many areas. We must continue to advocate for access to care. And the only way that I can get a patient in the door, unfortunately, in a system where I don't own the hospital system, is through some sort of coverage. And until we get to a coverage for all, whatever that looks like, the ACA is that tool that allows me to see patients who were otherwise locked out, literally. In fact, it's the reason that I'm voting for the candidates that I'm voting for sometimes on that issue. And I think it's important that we look at those issues. I mentioned earlier about looking at the facts, looking at the process. While we say we offer something, I recall having the opportunity to take care of pre-ACA, because I've been doing this for a little while, just taking care of a patient with a certain product who needed a specialist care. I could not find a specialist who took that very low reimbursing insurance for miles to take care of a very needy patient. Tax dollars probably ended up paying for that patient to receive emergent and unnecessarily emergent care. I think we need to understand that health coverage is critical, and we need to look for legislators and leaders who are running, such as mine in the 4th Congressional District of Florida, on historical positions to support healthcare access in the ACA. Negotiating healthcare is complicated. I get it. It's complicated. It's frustrating. I have an 80-something-year-old dad who I have to get somebody to help me to fill out his forms. And I do this every day on the back end. But it is just very important, like I said, that we understand when 2 or 3 people are gathered saying that we're providing care and access, understand what that process will look like at the local level when it's translated into your own community. And for those reasons, obviously, I support the AC and those who support it. But Caitlin, I'll let you speak to the specifics, as this is where you live every day.
So in terms of the ACA and pre-existing conditions, I think we're all aware of what a life-changing and community changing, world country changing event that was. I think the latest statistics I've been seeing are something like 50 to 129 million people, so somewhere between 19 and 50% of the non-elderly population of the United States has some form of pre-existing health condition. So that means that without the ACA, up to 1 in 2 people might be denied health care coverage. That's a lot of people who wouldn't be able to see a doctor if they didn't have enough money to pay out of pocket. That's a lot of people. So on the personal level, that's a big deal. And as you're saying, Dr. Kim, on the policy and systemic level, how do you provide care for those people, because they don't seek care until it's so dire that they end up at the emergency room, and then it becomes an even bigger issue, because then it comes out of tax funds instead of just seeing people when it's earlier, when it's a small problem that can be taken care of, and then they're better and everyone's better. So covering pre-existing conditions, whether that's through the ACA or a different program that still covers all pre-existing conditions, is crucial to the health of individuals and to the health of our society.
So I think that these are all fantastic points. I'm actually going to switch gears a tiny bit. We've talked a lot about sort of the traditional health needs, medical coverage, and a lot of the policy that's been going on. We've shared a ton of information. Let's switch gears a little bit and talk about mental health, right? As time goes on, I feel like mental health wellness and well-being and support is becoming more and more normalized, thankfully, in this country, and that people are proactively seeking out support in this space. And so specifically to support the many, many women and girls across our nation who have experienced trauma specifically, there are increasing access to mental health services in both schools and communities is going to be ever more important and a high priority. And actually, I would like to say this question comes today from our sponsor, Corning. We thank them for their sponsorship. So Dr. Kim, what are some interventions or successes that you've witnessed in your years of practice that we can lift up as models for how to do this work effectively?
As a family physician, as a trained family physician at Mayo Clinic, I recall walking in my first day of residency, and the quote from Charles Mayo said, "Listen to the patient, they'll tell you what's wrong." From that very day, I decided to share with my patient that I was there to listen to them. And what I also told them was that I was there to care for them completely as a family physician. That included their physical self, their mental health, and their spiritual sense, whatever that meant to them, whatever space. And ignoring any part of that triangle was negligence on my behalf. And I've had 2.5 decades of medicine practicing from that very first day of my family medicine training at Mayo Clinic, practicing with that very same approach. The potential long-lasting negative effects of trauma on a person's physical and mental health are devastating in ways that we still are learning. We're hearing more in the COVID space, in the coronavirus space, about mental health as we suffer isolations, but we're talking about a wide range of traumatic events that range from what we consider criminal type of events to witnesses of abuse and to other types of trauma. So in the medical community, trauma is trauma. And what we need to be able to do is to understand what that looks like. We don't have a trauma tool. Like we have a depression tool, we have a happiness tool, we have all these tools for screening and surveillance of our patients. We don't have a very effective one to capture the full scope of trauma, and we need to be able to understand what that looks like, what that sounds like when patients come into our space. At the school level, because this is not my area of expertise, I reached out to a dear friend and colleague in Iowa last night in anticipation of this, reading the survey, and said, "What are you doing in the school systems? How do you handle this?" And because she actually trains fellow educators in the traumatic space, she said it continues to be a very evolving body. And while states and legislative policy is there to support it, that there are probably multiple ways, therapeutic modes to handle this depending on the type of trauma. So I don't want to broad stroke this issue, and lots of technical strategies. But the short answer to the question is probably using some form of cognitive behavioral therapy, a space that is probably a new and a little bit more progressive, involves more than treat and street type of intervention to approach and appropriately deal with the impact of trauma, especially in our young people, in the long term. And then there are other modalities that include things like rapid movement desensitization and multiple modalities. But I think what we've seen in the evidence-based space is that cognitive behavioral therapy probably leads the way, and that our educators have resources to refer those who they identify. But the first step is first identifying what trauma looks like and being sensitive to recognize what that means to educators, to families, and to clinicians. And dare I say that we're probably as much in need of this training and this ability to recognize as any other group when it comes to the impact of trauma and recognizing what trauma looks like.
I think it's a great point, Dr. Kim, about trauma care training, especially in schools. I'm fortunate enough to partner with a nonprofit that specifically supports disadvantaged or kids and families that come from disadvantaged situations. And part of that engagement has been trauma care training for myself. And actually, we spoke yesterday, the three of us, just to get to know each other a bit. And I talked about how my husband is a high school teacher. And I can tell you, I would encourage, if there are any teachers, educators out there, or people who are listening who know educators, take Dr. Kim's advice. I would highly encourage self-education, research, training in trauma care, because understanding what this looks like and minor tweaks to the way that we engage with kids who've experienced trauma is so incredibly valuable and meaningful. And there's so much information out there that would just minor changes can make a big difference, and again, can encourage people to seek out the care that they may need and otherwise not really realize.
That is probably the thing that I took away most from my conversation with my friend Amy. I mean, we recognize that neurophysiology as clinicians, but it's the subtleties that using the wrong word at the wrong time in the wrong way, and what's wrong with you versus what's happened to you.
Yes, that's my favorite one.
To embrace, to move those who are hurting to a place of healing. So it's not easy, but it's necessary work that we must continue to do in the space of whether it's cognitive behavioral intervention and trauma training in schools, or in the clinical space, or in policymaking. But we must recognize that it exists, and it's going to need our very wide arms to wrap ourselves as a country around it in order to get past not only the trauma that we have known in the past, but the impact of the pandemic on top of the trauma that we have already recognized.
That's a great point. Caitlin, are there policies going through Capitol Hill that are specific to mental health support, and or are there resources that we can use to go research and educate ourselves about what policies are going through so that we can personally advocate for them?
Definitely. The first one I want to bring up is something that YWCA worked very closely with members on Capitol Hill on, and actually passed earlier this year. It's called the Trauma-Informed Care for Children and Families Act. And it does some of the things that Dr. Kim, you were just talking about. It provided funding so that school teachers and social workers and people who are first responders who are going to come into contact with young people first can have training on best practices to help children who've experienced trauma. So that bill has already passed and been signed into law. So we have some baby steps that are moving forward. But there's some other bills that are currently in Congress and probably need some help moving forward. They passed the House, but there needs some help in the Senate. So something called the Mental Health Services for Students Act of 2020 passed the House, but needs support in the Senate. And then the Pursuing Equity in Mental Health Act, again, passed the House, but needs some support in the Senate. So yeah, there are things that are moving, but could use some nudging with your members of Congress, especially on the Senate side right now.
That's a good call outs. Okay, we're going to switch gears a bit. We've had a couple of questions come through on the chat that I want to make sure if we have time, we can hit on some of these. A great question actually about for-profit hospitals and how for-profit hospitals may impact overall health costs and the ability for women and minorities to have access to healthcare, and or may impact the broader dynamic related to high health insurance costs, right? The more healthcare costs, the more insurance costs, and it's this big complicated issue. Do either of you have information on the impacts, or maybe we're over assuming what the impacts are of for-profit hospitals on healthcare and access to healthcare for women?
I'll leave that to you, Dr. Kim.
I was just hoping you were going to lead with this one. I'm going to gently lean in to answer this question because there's no real political way of saying that medicine is a business. And unfortunately, as is education, as is in aviation, as in so many other things. And for those of us who are just really in the space for lots of humanitarian reasons, and who really do believe that we are brothers keepers, it is disheartening to see some of the things that that exist in the space that we live. It's embarrassing. It's heartbreaking. The short answer to the question is I really don't know. I really don't know exactly what the true impact is. I suspect, though, that it's not a positive one. I suspect, though, that when I can go to a freestanding radiology suite and have my patient pay a quarter of what they would be charged at a hospital for-profit operation for the same test, read by the same radiologist, that there's got to be something that I'm missing. So the call for transparency in healthcare is extremely important. I go in and I look at, if I added the Coke and the French fries and got the meal for, not that I'm going to eat the Coke and the fries, but, is that cheaper than ordering, the individual items, so to speak. And I think the need for transparency is there. And that's what you're called, I think the question, the very wise question coming from the audience participant is calling, for, is the need for continued transparency. What is it costing? Why is it costing what it's costing? And whether it's this or in our pharma space and other areas that we're hearing about the high cost of healthcare, if we knew more of what it was costing and why we're being charged, and if we could get rid of these surprise charges with our EOBs, then I think it wouldn't be as much of a concern for the patients that I see, and it wouldn't be as much of a challenge for me to help my patients to negotiate their high deductibles and to make decisions that they have to make, and try to find what's the best way to spend their health savings, or to choose between groceries, medicines, and evaluatory tools that I need in order to diagnose their conditions appropriately. So I'll leave it at that.
It's a complicated issue, I think, is what we understand. And one thing that I sort of took away from that commentary, Dr. Kim, thank you for leaning into that one, is that push for transparency. I 100% agree with you. And as much as we can all individually sort of, I say so often, voting with your feet is sometimes and your own actions is sometimes the best actions that we can take. And so even though it may feel tiny and feel like not a very impactful action to take, as much as we can as individuals understand the cost of our healthcare and vote with our feet and maybe go to that freestanding radiologist, right? Or, that X-ray facility rather than going to a large facility, overall healthcare costs will go down. Maybe some of that collectively will make a difference. And so, again, going back to education is key, awareness is key, is what I took from that. Okay, let's hit one last question coming in. What's the best way to adjust services on the ground in a way that responds to the seemingly ever-changing legislative environment? Caitlin, I'll throw this one to you. I think it's a really great point, right? If we chased who was in control of Congress at any given moment, or the House or the Senate or the White House, we would be shifting and moving all the time. I feel like is the spirit of this question. What are the on the ground level services that, or changes maybe that we could advocate for from either of you that you feel like you see make a difference beyond sort of the big heavy hitting legislative changes that often get the most public attention, right?
Well, I feel like this question might be asking about healthcare services, and because I don't provide them, I'm a little wary to answer.
I would also say,
one.
we'll punt this one to Kim for a second, but if there are also even homegrown local shifts and changes in policy or advocacy that you've heard of that work, we'll come back to you on that one. But Dr. Kim, do you have ideas on services more in the healthcare space that might be beneficial outside of waiting for the legislation?
I grew up on a 13-mile island, and I'm kind of MacGyver in my approach to anything. Sometimes I am forced to, hate the game but not the player. So if there are grassroots operations, church-based operations, community organizations that can get me to what I need with my patients or the people for whom I'm advocating, show me where they are. As you know, as you mentioned in my introduction, I'm part of this amazing organization of women with chapters around the world who actually focus on things like health and wellness in women. And one of our major targets is healthcare for women. And I think that just leaning in with those community partners as best as you could, as best as you can identify them, to move along your platform, to partner with your partners until you get some push and some shove, because sometimes I have no idea. I've learned so much in 24 hours in meeting Caitlin about what's going on in Capitol Hill, and I think that I'm pretty savvy about keeping up with what's been going on politically in this space. I'm raising a 17-year-old daughter who wants to be journalist. We're keeping up with the news more than I would like to, because I need her to be exposed to what good journalism looks like, and yet I still don't know. So it's important, I think, just to work with what you have, stay at the lowest common denominator, take advantage of low-hanging fruit, but never devalue yourself or your cause so that you don't realize that if you deserve more, we should continue to push for more. And we should challenge those who are speaking in our behalf to do more. And with that, again, I go back to what I'm saying is as we good intentionally try to advocate, it's important that we understand and we see through the eyes of those who we want to help. While these policies may be mixed with a whole bag of things at Capitol Hill and may march out in a way that looks globally sound, what is the process? Do we understand what that brings and what that doesn't bring? What's the narrative that our organizations are saying, and what's the narrative that we're not intending to send, but that we are sending? And I think it's important that we equip our partners and equip people, our friends, our relatives, to be more critical of what they're hearing and what they're consuming in the space of policy, because I think it's important. And if we can understand that, we can more craftily navigate this territory, because it's not easy. It's definitely not easy, and it's something that if I had the answers, I would probably be a hero of at least two people. But it is definitely not easy.
I think it's a great point, and I love what you talked about around every community is going to be different, right? And these grassroots organizations and community organizations are doing a lot that we often don't know about. And so it sounds like if we have a particular topic, maybe it's trauma care, maybe it is, reproductive rights, whatever that may be, doing our own research locally to find out what community organizations advocate for positive change in that topical area, and then engaging with and supporting those organizations feels like a great first step. Caitlin, I wonder do you have insights on things that maybe, or do you see activity amongst local organizations that make a difference when things even get to Capitol Hill? And what is it that works well in that space to the extent that you're seeing, local organizations have an impact and have a voice? What is it about what they're doing or their approach that's productive?
Yes. Well, I mean, first, I wanted to agree with the statement that those things locally you can do, things like working to expand Medicaid in your state, expanding the number of people who are eligible or the range of eligibility, working to protect reproductive health in your state or your community. All of those things can be done locally. And again, reaching out to those organizations that are working in your area, because they're going to know the inside game better than you do if you're first starting out. Calling your members, meeting with your members' local office is really effective. It's difficult to do right now in this that we're living in, but most of them are holding Zoom meetings, and local offices are really important. You don't need to talk to the people on Capitol Hill to have an impact on Capitol Hill. It's often easier to talk with your member when they're at home. And by home, I mean their home office in your community, because they listen more when they're close to you than they do when they're in DC sometimes. So reach out to them then. Reach out to your state legislators, because sometimes the things that happen at the state level are more important. Run for office in your state, in your community. Make sure you participate in those elections. Those elections make a difference. participating in your school board elections, in your local community elections, in your elections for sheriff, and all of those things that we don't think about participating in. Make sure you participate in all of those. Just go vote. Please go vote. All of those things are really, really important, and they're things that we can do that that don't involve us like marching up to Washington. And they will make a difference in healthcare, because those people that we're electing are the people who decide about our healthcare.
And those are great ideas. I will shout out. I think Kristen's note just went to everybody that said, and when you're talking to your elected officials, share real life stories, because those anecdotes help things hit home. So we're at the bottom of the hour. I'm going to wrap us up. One thing I will make a plug to something that Caitlin just said. You don't realize how many elections are going on a regular basis for all of these things. And the other thing I didn't realize, I signed up for mail-in voting this year for the first time ever. And what I learned in doing that was that I could check a box that said I wanted to sign up for mail-in voting for every election from here forward. And so what that means is I'm not going to miss an election. The ballot's going to show up in my mailbox, and I'm going to be able to participate more easily. So just like I have automatic bill pay set up, I'm going to have sort of automatic voting, at least triggering me in my mailbox. So I'd advocate for that to the extent that people's local jurisdictions allow for that. Thank you, everybody. Thank you, Caitlin. Thank you, Dr. Kim, for joining us today. Thank you, Kirsten and the YWCA of the Central Carolinas. Thank you to our sponsor, Corning, and thank you to CapTech Consulting for helping us with this today. This was a great conversation. It's been a wonderful series. I have learned a ton. I would encourage folks to do two things today. First off is go take a listen to our prior conversations. If you enjoyed today's discussion and learned things, our other videos are available out there on the web, and you can find out more great information and advice from experts like Dr. Kim and Caitlin. And then I would secondly request that you guys, anyone who's listening today and who signed up for our webinar, will be receiving a survey in their email box. Please do make sure to fill out that survey. Your feedback helps us make these programs better in the future. So thank you in advance for taking a couple minutes to do that. Kirsten, anything else that you want to add in to wrap us up, being the last in the series?
It's been fantastic to partner with CapTech on these three panels. They've just been wonderful, and we just appreciate you all very much. And thank you, Dr. Kim and Caitlin and Elena.
Thank you, everybody. Have a wonderful day.
Bye.